Fluoride is the negative ion of the element fluorine. It is widely found in nature in trace amounts. It occurs naturally in air, soil, plants, rocks, fresh water, seawater, and many foods. Fluoride also plays a role in the mineralization of your bones and teeth, a process essential for keeping them hard and strong. In fact, about 99% of the body's fluoride is stored in bones and teeth. Fluoride is also important for preventing dental cavities. This is why it is a common ingredient in dental care products and often added to the water supply. Groundwater naturally contains fluoride, but the concentration will vary. For example, some areas of India have dangerously high levels of fluoride in their water supply, the consequences of which we will look at later. Dental cavities or tooth decay are an oral disease and are caused by the bacteria living in your mouth. These bacteria break down carbohydrates and produce organic acids that can damage tooth enamel, being the mineral-rich outer layer of a tooth. Fluoride may help prevent cavities by decreasing demineralization and enhancing remineralization, which is effectively reversing this process by inhibiting bacterial growth and bacterial acid production in the mouth. Fluoride may also help prevent bone fractures, since it appears to link to enhanced bone remineralization too. Fluorosis can occur after prolonged exposure to excessive amounts of fluoride and can either affect the teeth or bones. Mild dental fluorosis, characterized by white spots on the teeth, presents only a cosmetic issue, and more severe cases are less common, but are associated with brown stains and weakened teeth. Dental fluorosis only occurs during the formation of teeth in childhood, but the most critical time is under the age of 2. Skeletal fluorosis is a bone disease that involves the accumulation of fluoride in the bone over many years. Early on, symptoms include stiffness and joint pain. Advanced cases may eventually cause altered bone structure and calcification of the ligaments. Skeletal fluorosis is particularly common in countries like India and certain other Asian and African countries, where it's primarily associated with the prolonged consumption of groundwater with high levels of naturally occurring fluoride, and only happens when people are exposed to very large amounts of fluoride for long periods of time. It is typically not an issue in countries with fluoridated water, as the fluoride content of water is tightly regulated. There are some concerns about how fluoride affects the developing human brain. In 2019, research found that excessive fluoride exposures in children were linked to cognitive defects. Another review of studies that included data on over 7,000 children had similar findings, noting that high fluoride exposure from water was associated with lower intelligence. These two reviews, however, were both investigating areas where the fluoride level is naturally high. A small separate study on Canadian mothers and their infants found that formula-fed babies receiving formula made with intentionally fluoridated tap water had a lower performance IQ than breastfed babies in the study. Despite this, the body of research does not suggest that fluoride is neurotoxic at levels typically seen in developed countries. However, excessive fluoride exposure in infants and children does warrant further exploration, especially in areas where fluoride levels are naturally high. As with many other nutrients, fluoride appears to be safe and effective when used and consumed in appropriate amounts. It can help prevent cavities, but ingesting it in very large amounts through drinking water or other means may lead to serious health issues, but appears to be mainly a problem in countries with naturally high fluoride levels in water, such as India. The amount of fluoride is tightly controlled in countries that intentionally add it to drinking water. However, some evidence suggests that even controlled levels of fluoride in water may affect brain development in infants. While fluoridated community water appears to be mostly safe, new research is needed to assess its overall effectiveness.